Hello, everyone. My name is Mark Kagiyama, and I'd like to welcome everyone here to Be Your Own Hero. And I'm a stage 4 cancer patient with prostate, bone, and lung cancer. And I am so thankful to have everyone here. And please subscribe, like, and make a comment in the comment section of the video. And I am so honored to have one of my co hosts of our cancer conquering community here with me, Alexandria, and we call her Alex Rosa. And I am so excited to have her. She's just amazing in which, and she is a nurse. And I'll let her tell you what else she does. She's got you can see Spice in the background, and that's one of the things that she does. So, Alex, I'd like to introduce you. Please introduce yourself and tell us a little bit about what you do.
Hi. Yeah, thank you. Thank you everybody for joining us. I'm so happy to have met Mark and to be learning all about him and becoming part of his great community that he has. I am from Ohio. I am a registered nurse and I've been in healthcare for about 18 years now in several different roles. And I am a educator. I am a nurse educator. I teach first year nursing students on the weekend at my local community college. And I also am a holistic nurse. I'm a registered nurse, but I also really embrace the holistic philosophy and bring that to my teaching and to my bedside practice and to Spice. And I have a YouTube channel that you're more than welcome to check out. You simply have to search for Alexandria Rosa and then put Spice after it, and I will pop up. And my channel is all about spreading positivity and inspiration. I've got a little bit of sprinkle of my personal life in there about being a mom, being a graduate student, because I'm finishing up my doctorate in nursing right now and I'll be graduating this spring. So I talk about some of my school journeys in there and just some personal things about my life and things that I've gone through. So definitely a little bit more personal of a channel there, but always sharing great, positive, inspirational messages. I've got some information about kidney health and kidney care on there as well, because I'm partnering with a really great group that focuses on kidney health. So I have some information on that as well. But I also talk about all kinds of different health topics on there. And my personal connection to cancer is my mom is a breast cancer survivor. My uncle passed away from leukemia about 14 years ago. And I personally have had some scares with some lumps and breast cancer type scare, and I have cared for hundreds and hundreds and hundreds of patients over my whole career, cancer patients, every type of cancer patient I have had. So I have a really great connection of personally being connected to it, but then also caring for patients and families that have been affected by cancer.
I am so fascinated by your story, Alex, and I hope we have enough time to share uh, a great message, what you bring. And so I wanted to ask you, what made you want to become a nurse? And what is your perspective as far as the patient goes?
When I was younger, I wanted to either be in some type of healthcare, taking care of people. I wasn't exactly sure what, or I wanted to be a veterinarian. That was where I started off. And I actually originally was going to go after I graduated high school. I was going to go right into a nursing program. I had got into college and I ended up just failing after like 6 months. I had to drop out of school and totally failed. And so, kind of another element to my story is, don't let anything hold you back. And I always had this feeling inside that I was meant to help people. I wasn't exactly sure how or what that was going to look like, but I always knew that that was something that I was going to do with my life. And so after a couple of years of like trying to figure out what I was going to do with myself and floating around, I finally committed and went to my community college and applied for a nurse aid training program. And that's kind of where my whole introduction into healthcare started, and where my journey started, from being a nurse aide to an LPN to an RN, and then now finishing up my doctorate. And once I started getting towards this higher level and in graduate school, I really found my love for teaching and for education. And I absolutely love being a teacher. I've been teaching for the past couple of years. I love beginning nursing students. They are my absolute favorite. And the one thing that I try to teach all of my students, and really my perspective and the way that I practice nursing, is to treat the person as a person, to treat them as a whole, really look at the holistic perspective, holistically at your patient. And it's not just the diagnosis, it's not just the lab results, it's not just the I'm doing this, this, and this to my patient. It's who are they? What are they personally going through? What is their family going through? How can I really care for them have the best outcome, the best experience possible? And that's really been my perspective, and everything that I've been working for during these past couple of years has really been all about that. And to be it hasn't always jived with places that I've worked, because they they have things that they want you to do, and that's kind of how I veered off into doing spice and teaching more of a holistic way of being as a person, and helping other people who might have a chronic disease or a chronic illness, help them use spice to live more of a holistic life and to heal themselves holistically, and just a way of being and a way of living. And so that's how I teach all of my students as well. I teach them all about that, and to really think about their patients in that way, because I knew as a nursing student, I really wasn't taught that way. Nobody really explained things to me like that. And now I've come to see in my practice that that's the most important thing, and the most important way we should be treating our patients is in that way.
I was totally intrigued by you as a nurse and your perspective. Um, I've been in the
Mhm.
hospital. I was in the hospital last spring for a week, and my
Mhm.
connection to the world were nurses and doctors to a much lesser extent.
Mhm.
But the nurses, the different nurses kept coming in the room, and that was my connection to the world. And I was so thankful that the vast majority of the nurses were so pleasant to be around and compassionate and really seemed to take an interest in care, which just meant so much to me, because when you're in the hospital, you're isolated from the world, and your connection is the care of the nurses. And I am so thankful that I've I've had at the facilities, but also at the hospital. When I was in the hospital, nurses were so important to me and my care. And so, what I wanted to ask you is how how do you relate to the compassion uh, towards a patient? How important is that to you? And
Mhm.
how do you relate that to your students as well?
Mm. Yeah, yeah. I definitely, I definitely treat my patients when I'm practicing. I like to get to know them. I like to get to know their family. You won't even believe how often people don't even know a patient's name or who family members are. Sometimes but it gets so busy, and all those little things get lost. All those little things that make such a big difference get so lost in the day to day. And so that's how I really teach my students to just step back and to really get to know your patient. Look them in the eye, use their name, get to know their family, because a lot of times the family is the best source of information that you're going to be able to get about that patient, depending on how ill they are. You really need to rely on that family and have a really good relationship with that family. And I think also it helps the patient to feel better if they know my family's being taken care of, because we often worry about our family members, and we're leaving them, and what are they going to do without us? And I think if you can be the nurse and kind of be that bridge between the family and the patient, that puts them at ease, because it lets them know that my family knows what's going on. I trust this nurse. She's going to let my family know all what's going on with me. I don't have to worry about that. I can just focus on myself. And that's another huge part, and just helping the patient to feel calm, to feel relaxed, so that they can focus on themselves and their own healing and not have to really worry about all the other things that are going on. So that's just one of the ways to just slightly change how we are practicing at the bedside, and to make us think in a little bit of a different way when we're caring for our patients. And I absolutely love that part. I love getting to know the background story, where people grew up, what they went through, what are they looking forward to, because a lot of times, and I know you can relate to this, um, a diagnosis can come at the most inopportune time. You might have big celebration coming up, or something you're really looking forward to, and then all of a sudden you get that diagnosis and you're like, am I even going to be able to be there for that? Am I going to be able to travel? Will I even get to see them again? Will I get to talk to them? And helping them to stay positive, helping them to see that they are going to be able to make it there, and let's do what we can now so that we can make that more of a reality for you later on. Just helping them stay positive and looking forward to things. All those little things go so far.
One of the things that I love about you is your positive attitude. And I mean, that's
Mhm.
always so refreshing to me. And if you wouldn't mind, speak about the mindset and positive
Mhm.
attitude, and spreading that positive attitude with your patients and your students.
Yeah. Yeah, I always got comments from coworkers like, Alex, you're so upbeat and you're so positive. You're always in such a good mood. And I have things that happen to me in real life, and it's just how I choose to confront that situation and how I choose to react to it. And I always choose to react on the positive side, to look on the bright side, to see the opportunities and these challenges that I might have. And that's just in my personal life. But when I come to work, I can't put that on my patients. I wouldn't feel right putting that on my coworkers. And so that was always how I came to work, because I'm like, we have to work together. We have to get through our shift. We have a positive day. We have to take care of our patients. We have to show them and show up for them to help support. So it's good to start cultivating these practices on your own. So when you come to work, you can be like this. And those are always the comments I got, always, or what was going on. And so I did kind of realize I was in the vast minority of people who would show up to work like that and feel like that. And when I would care for my patients, and it's kind of harder now with the masks to smile, but smiling was such a huge thing before we had to wear masks. Smiling when you went and talked to your patient, looking them in the eye, all those little things. And just, I can't get over have building a relationship with them and talking with them, and knowing what are their fears, what are they afraid of, what can we help you work through today, because every is a different challenge. Sometimes it can seem every moment is a different challenge for someone. And I think just talking with them and treating them like a person, and coming in and knowing they're feeling, what's going on with their life, and sharing with them something inspirational may be heard, or sharing a story about my life, or getting to know them and getting to know something that they went through in their life that they overcame. So all those little things we can use to build a relationship over, and helping your patients stay positive has huge physical impacts, right? We know if we are sad, if we're depressed, if we're anxious, that slows down our healing process. So I always try to keep my patients upbeat, looking forward, engaged, knowing what's going on with themselves, letting them know what's going on in the world. Those are all so very important. So that's just some of the ways that I.
What you mentioned that you've dealt with uh, a large number of cancer patients.
Mhm.
Is there one or two that really resonated with you that you know, really remember, and what was that experience like?
Mm, I don't know if I can really pinpoint one or two that really stuck out to me. I just remember with all of my with all of my patients how scared they were, and kind of the story that I relayed to you about the diagnosis or this hospitalization coming at the first time. Oh, you know what? No, a story is coming to me. So hold on. I'm remembering this now because I'm picturing the laptop on the bedside table. That's what happened. A patient had his grandson graduation, was a graduation, grandson's graduation, and he was supposed to go to it, and he couldn't make it because he ended up really sick and ended up being in the hospital. And so we had to help him get on his computer so that he could watch the graduation through the laptop. And so we ended up doing that for him. And I know we've done that a couple times with some different things, but I specifically remember this guy because there's a couple of us in there with this computer. But it's just stuff like that. It's like whatever we can do to help them bridge that connection to those other people, to what they missing that's going on out there, because life never stops. Diagnosis, it seems like it always does happen at the worst time, but we do what we can so that he can be present. And man, was he happy that he got to see it, that he got to like talk through the computer. I mean, it was amazing. And now with COVID, we're seeing that more and more, that we're having to get creative with things and do that. But this was like a couple years ago, where it wasn't that common to do that. So we were able to help him with that. And it's just making them feel like they're not missing out, because when you miss out, it really puts you in a bad mood. It really puts you in a down mood. So we do whatever we can to connect them the best we can, to see those people, to talk with them, to engage in that experience as much as they can. But I do remember that guy with the laptop and the graduation. I remember that.
That's a great story. Yeah, I mean, I see it's so important for you to, with your patients, to make them feel comfortable and
Mhm,
happy, and uh, you know, because when we go through all these medical procedures, they're not fun. they're not they're not fun at
mhm,
all. In fact, they're
mhm.
many of them, which I've gone through, can be really, really rough. And so
Yeah,
the as a nurse, it's so important to bridge that gap and give, you know, provide some comfort to that person as they're going through it. Because,
mhm,
you know, I look at, you know, whenever I go to facilities and things like that, and it's like people are like in a trance, or they're just like, you know, I'm
mhm,
here just playing it out pretty much. And
mhm,
I don't feel it has to be that way at all, you know? And
mhm,
so
mhm,
I think it's so important what you do as a nurse to bring uh, a certain amount of happiness and comfort, and what you're doing is with your Spice Channel and teaching. I mean, I love that. I absolutely
yeah.
love, you know, what you are doing, because that's what I love to do. Is I love, and that's why we get along so well. Is we have that
Yeah,
same mentality. We have that same mentality, and that's what we want to spread. So if you could talk
yeah,
about that part, you know, how how important the connection is.
yeah. And I was going to say too, with me teaching my students and how I teach them and making sure that the patient is comfortable. One of the biggest things that I find that frustrates me, and one thing that I personally experienced being a patient in the hospital, when I had my son a couple years ago, I was a patient and I had a really difficult labor and delivery, and I had a horrible patient experience, terrible patient experience. And that experience really changed how I practiced at the bedside and how I treated my patients and how I approached their room and all the things I did for them. So that's what I've carried over to students and how I teach them. when they first start to interact with patients, because some of my students like never been in a hospital. They've never been in a hospital. They've never been a patient. I mean, it's all brand new to them. So just walking up to a patient's room can be so intimidating, alone knocking on the door and introducing yourself to a total stranger that you're going to do all these things like it and spend 12 hours with. It can be really overwhelming. So I really teach them to approach the patient's room like it's their house, and to be very respectful and to knock, because that's the only place where the patient has to feel safe, or they feel like they have some privacy, or they should, right? They should feel safe. They should feel like they have privacy there. So I always teach them to pause, to knock, to wait before they enter. Really treat it like it's the patient's home. And I really teach my students to organize their day and organize their time so that they are allowing as much comfort, as much privacy, as much rest as they can for that patient. So they are not overwhelming that patient, because just like you know, and many others know, there's so many people that come in and out of those rooms all day long and try to get a nap, try to get some rest, try to have some privacy. It's not happening. So I really teach them to organize themselves, get themselves together, do as many things as they can at one time so that they can allow that patient to rest and relax and to heal and to have some time alone, to be comfortable, to not feel like we're always intruding all the time and like they don't have any control. That loss of control is a huge part for me. And I said, I don't ever want to feel like this. And I don't ever want patients to feel like this. So I want to let them know what's going on, have them involved, give a rundown of what we're going to do today, try to make it as structured as I can. And that's how I teach my students. And that helps my students, but it most importantly helps the patient, and it helps the patient heal. And that's the one thing that I have found that I do that not a lot of other instructors do. Not a lot of teachers are teaching that way, but I found personally that's what I went through and what I had to learn, and now what I pass along to them. So really treating that room like it's their home. It's their home while they're there, right? Because you could be there a couple of days, a week, a month. You can be there a long time. And so we need to be respectful of our patient. And that's another way of building trust and making them feel comfortable and easing their mind, easing their body so that they can heal. That's been another huge thing for me.
When I was in the hospital, at midnight, every midnight, I was in there a week. Every midnight, they would wake me up and they would do a chest X-ray because I had a botched lung biopsy, and
Mhm.
so they would wake me up to do a chest X-ray. And
Mhm.
the first night, the guy came in and he just like shoved the thing in my back, and you know, I'm half asleep, and he just, you know, basically manhandled me, and I was like, hey, that wasn't cool. So the next night
Mhm.
he came in and he apologized, and he said, I'll be more careful, and he was, and from that point on, and then at 4 in the morning, I'd have a nurse come in and do a blood pressure check. So
Mhm.
I mean, you're put in situations as a nurse that a person may be sleeping or resting, and all of a sudden you have to come in there and you have a job to do, and so that's not the easiest thing to do to bridge the
Mhm.
gap there.
Yeah. But just, I think just being upfront and letting your patient know kind of what's going to happen. And I also try, pain is such a huge part of cancer. A lot of times is pain. And if you can pre-medicate your patient and make them comfortable and say, hey, I'm going to give you some pain medicine now because I know in 2 hours I need to come do this, this, and this. Or they're going to come move you around, Mark, and get you ready for X-ray. Let me give you some pain medicine. So when they come in, you'll be nice and comfortable and chilled out. Little things like that that are special to this type of patient population for patients here with cancer. And that's another way that I I like to have my students involved, have them have patients like that to take care of, because those are special considerations you have to make for these types of patients. And also infection control and keeping things nice and clean and sterile is another huge thing. Washing your hands, wearing gloves, make sure the area in the room is clean. That's another thing that drives me crazy. Make sure your patient's room is nice and neat and not cluttered, and just treat it with respect. I mean, it's just basic, but I can't remember how many times I've come into rooms and they're just a disaster. And it's like, keep it clean, keep it neat for your patient, for their safety, for cleanliness, for infection control. Please, please do that. So all those things are just those special considerations that we make for cancer patients, keeping their pain in check, making sure they're able to rest and recover, working on their mindset. And that goes along with all the things that I teach about in Spice that you can really apply to patient care and taking care of cancer patients. So thinking of S of spices, spiritual health. Thinking about the P is their physical health, their physicality, and I's for insight. So thinking about their mental awareness, their self-awareness, mindset. And C is interesting because C is for career. So the C of spice stands for career. But how I like to look at it is some people really define themselves by their career, by their job. And you can get to know about a person by finding out what their previous career was. What was your job? What did you do? Or what are you like, taking a break from? Because if you got somebody younger that's diagnosed with cancer, they might still have a job that they're trying to rock and roll with, going through this diagnosis, going through treatment. So always understanding that part of somebody's life can be so important. And the E of spice stands for emotional health. So emotionally, how are we supporting that patient? How are we helping them to be happy, to be joyful, to stay in that positive mindset, and also keeping an eye out for any like trigger signs, warning signs that we might see that they might need a little more support in that emotional area.
We've You're one of the co-hosts of Cancer Conquering Community, and so I just wanted to get your thoughts on we have a room, what we call a room, on the Clubhouse
Mhm.
app, and I know you're one of our new moderators and co-hosts, and I just wanted to get your thoughts on the room and what you see and what your experience is.
I have absolutely loved it because even though it's new, it's been growing. Every time we get on, there's more people. And like we were talking about the other day, I feel like it's such a great place for people to go because people are looking for information. People are diagnosed every day with cancer and they're looking for answers. They're looking for support. And I can't think of a better group of people who have real life experience, come to the table with actual information, not just some stuff you're finding on the internet. Like it's real. Like, I'm a nurse, you're a cancer survivor. We've got other professionals in that group, other survivors in that group. It's like firsthand, real experience, real information that you're getting in that group, and so much support. I mean, people like we've only met last time and you have a conversation, you're like, oh my gosh, what can I do for you? How can I help you? Who can I put you in contact with? It's such an amazing group. It's so amazing. And they're looking for answers, looking for support. And this group is such a great place that when you find you're going to want to stay, and you're going to want to tell a friend or two to come join and see what we're talking about and come and ask questions. That's what I really loved about one of our last calls was people asking questions. And I like that I'm there because I can give a medical answer for a lot of these questions that people are asking. And it's like real. I've been a nurse for a long time. I know what I'm talking about, and I can really help people work through some of the challenges that they're having. And we've got other great people in the group that can help people in all different areas, with their life and with their emotional health. I mean, there's so many great people in this group. I can't even begin to say enough about it, but it's a great group. So if you or anybody you know is suffering with cancer, or going through it, a diagnosis, a friend, a family member, this is a really great place to start and get information, but also to stay and to grow with us, because we'd be growing so much so soon, and it's a great place to be.
I couldn't have said anything better. Thank you so much, Alex. And I
You're
really
welcome.
appreciate you. I really appreciate you. And do you have any final thoughts that you want to share with everyone?
Do I have any final thoughts? I would say that definitely join our clubhouse for sure. And don't let the word clubhouse scare you, and don't be scared of the technology, because I just started joining Clubhouse and getting on it just a couple weeks ago, and never did it before. But it's amazing. It's amazing the people you can meet from all over. From all over, there are people. So it's a great place to meet. And I would that the support is out there, and support is here for you more than you realize. So if you feel like you're alone and like you're isolated, you're not. We're here for you. We're here to support you. Connect with us on social media. It is that easy. Just reach out and say hello. Reach out and tell us your story, because we want we want to know how we can help you, and we're here to support you in any way that we can. What I gotta say.
Thank you so much, Alex. I'd also like to point out that we have our clubhouse get togethers, Cancer Conquering Community, on Thursdays at 12 p.m. Eastern Standard, 9 a.m. Pacific Standard, every Thursday. And now what we're doing is we are now doing everybody, we had a Zoom call in and people loved it, absolutely raved about it. And so now we're also adding a once a month Zoom call on the second Friday of the month. So our next Zoom call will be February 11th, in addition to our weekly clubhouse get together on Thursdays. And so, what I'd like to do at this time is to thank you so much. It was, I just love, we could talk for hours, and, but we're not going to do that. Uh, Thank you so much, Alex, for your insight and your knowledge. And I'd like to thank everybody for joining us here at To Be Your Own Hero. Please subscribe, like, and make a comment in the comment section of the video. And also check out Alex's um, YouTube channel. Once again, please share your YouTube channel with us.
You can search my name, search Alexandria Rosa, and then put spice at the end of it. So Alexandria Rosa spice, and you will find me.
And there you go. And thank you so much for joining us here. And everyone, please have a great week and enjoy your health, enjoy your life, and appreciate all these wonderful things. Life is incredible. And, once again, let's all come together. This world has become so divisive and so uh, I don't know what the word is. I've just never seen this world like it is today. But let's all come together and be positive and band together, because that's what makes us strong. And thank you to everyone, and appreciate every single day, every single hour, every single minute, and every single second, because life is that great. And we'll see you next week, and be blessed, everyone. Thank you so much, Alex.
Bye.